Thanks, Ms. Skinner. My name is Henny Bitta. I'm a GP here in Western Sydney. During my 21 years of general practice here and 1 year on Medical Staff Council of this hospital and 9 years on Blacktown and Mount Druitt, I found lots of wasted money. I found lots of bureaucracy, lots of meetings, then they go to non-meetings, even involving general practice. You go for a year talking about how Medicare locals will be, then COEX torpedoed it. You go for a year talking about a new mental health program, then you find that you have an invitation from another group which are doing the same program. You do antenatal shared care in the hospital, then they want one in the community. The minister has been a good minister in talking about how much they spent and how much they put and how much beds they have. I'm still not clear on what's the diagnosis. Why aren't we, despite of this, going forward? The duplication, the waste, I mean, I was going to tell Carmel that I'm not going to ask you for more money. I'm going to ask you to reduce the wasted money. In my opinion, a Department of Accident Emergency is not here to do pregnancy tests at 10 o'clock at night. And if someone wants it, they should pay for it. And there are lots of wasted money into that. I'm interested in your thoughts. I personally think that the only Minister of Health who listened to general practice was Maurice Yema. Maurice Yema started Health One.
Can we keep it concise, please, so other people can get a chance?
Thank you. I think I get the gist of it. Look, I need to capture you because I need everybody that's going to tell me where the waste is. So could you please give me your card after the meeting? Look, I know there's lots of waste, and the thing that really annoys people more than anything is the waste of their time, coming to meetings, being consulted and then their views not taken any note of, or filling in forms, providing input to data that disappears into the big black hole. I met with Peter Garling last week to discuss where we're up to in his report and so forth, and he and I agree that one of the things that we need to get much better at is that it's providing you who provide all of this information with the information back. Let's come clean. Let's actually show what is really happening, and so that we can actually make certain that we're doing it the best way possible. And that will be looking at where there is wastage. I think that we've got the capacity to do much better with what we've got. I do think we need to keep increasing the budget. I'm sorry, I'm not going to be, I let my treasurer off the hook that easily, because we have increasing costs of salaries, goods and services. But yes, we can do much better with what we've got, and that's one of the reasons why I'm looking at this whole business of investing in prevention, in better management of chronic illness, of keeping people out of hospitals so that we can actually make those hospital beds there and available for people when they really need them. But don't forget to tell me about your examples of waste.
Up there, sir.
Where are we?
Eugen Mudlier.
You have to excuse me because the light's so bright I can't see anyone.
That's all right, I'm here.
You're here.
Hello.
Stand.
I have a question for the Shadow Minister. Is it your intention to change the Health Services Act? And the reason I ask the question is, what's happened with the Garling report, it's been retrofitted into the current Health Services Act of 1997, such that the local health boards, right, health network boards, do not have the delegations of authority to do their work. So currently, it sits with the Director General and the Department of Health. Now, we've got to change that, and the only way to do it is to change the Health Services Act.
When the LHN, I presume everybody understands all these jargon, initials and acronyms, when the local health network legislation came before the Parliament, on behalf of the Coalition, I acted on behalf of the Coalition in leading the debate. We did not oppose it for the reason that a lot of the local involvement, the principles of local involvement, reflected very much the view that we'd expressed in making it work. However, I said in the debate, and it's on the record, that I reserved the right, if we're elected, to revisit, particularly in relation to governance matters. And one of the things that I have said, and I was partly talking about it when I was talking about the need to make sure that our board members have the real skills that are necessary, I intend to appoint, when I amend it, I will rename them District Health Services, as we've indicated in the policy, And the district health boards would be just that, they would be boards, and they would have real clout. And I want to remove the layers of red tape that separate those boards from real decision making. So I would be a minister that doesn't want to get involved in day-to-day interference in what's happening in your hospitals. I think that that should be an operational matter left to the board, to the general manager and to your district administrators, according to the policies that have been established by the Minister and the head office of the Department of Health. But we are not going to be interfering in day-to-day matters.
Well, we've got one more up there, have we? Okay,
James
one more
Butler
up there.
from the Western Sydney Cancer Advocacy Network. I would like to ask you a question in relation to cancer prevention and again in relation to smoking. If elected, will you be encouraging your party and voting for the introduction of state legislation to ban smoking in alfresco dining areas, where staff, mostly young staff, and diners are subjected to dangerous second-hand smoke? Will you make a commitment to do that?
The question of alfresco dining is one actually that I led in the debate a few years back. And in fact, along with Anne Jones from ASH, we really put the push for outdoor dining, etc., etc. So personally, I'm very supportive of the view. It's the kind of thing that I'd need to discuss with my shadow cabinet, but I believe we have a very proud record in terms of smoking. People forget that it was Peter Collins as Minister for Health, first Minister for Health in the Greiner government, that actually made the first moves in smoking, about anti-tobacco, but when he banned smoking from public buildings. And at that time, people were shock horror, couldn't happen. Then there were bans on advertising at sporting events and so on. So it's been incremental and slow. And so I believe we should be working towards these bans, but it's not always just a matter of simple legislation. It's about bringing people with you. And I think we've done well so far, but much more is to be done.
Dr. Sian Tomlinson from the pathologists.
Thank you, Mrs. Skinner. The 2009 report on the Australian Council of Healthcare Standards showed that New South Wales lags behind the national mean in terms of significant pathology turnaround times. For instance, small biopsy reports and other emergency department pathology results. I would like to ask you on behalf of the College that in the background of ongoing health reform, what are your strategies to ensure that pathology is not forgotten as a medical clinical service and that our services are adequately resourced?
Thank you. I have had much involvement with the College of Pathologists over the years, dating back to when I think before the last election there was a plea to provide 70 extra pathologists for the New South Wales health system. Can I tell you I haven't forgotten that, and I understand the need to increase the pathology workforce, to make sure that the colleges work with us as we develop workforce plans into the future, and I'll be putting out more specific policy about that in the next few days, but also to make sure it's on the national agenda. In general, I think New South Wales has missed opportunities to put these items on the agenda at both COAG and the Health Ministers' Council, and that is another thing that I'll be doing. Just in that relation to that, I, as part of the panel last night at Sydney Morning Herald debate, Professor Ian Hickey was one of the panellists, and he suggested that to both Carmel Teppert and I that one of us, whoever was the minister, should ensure that the Premier took to COAG a demand that the Commonwealth put $2.4 billion on the table for mental health. Ms Tebbett said that they supported COAG as it was and they'd signed up to it, and I was very happy to say I would definitely raise that with Barry O'Farrell. I think it's a very sensible idea. I think we do need to put a whole lot more things on the agenda in terms of health reform. That's one, mental health, workforce. We need to progress the work that's supposed to have been done at the federal level, but also at the state level.
Tony Joseph from North Shore Medical Staff Council, Jillian. Thank you for coming out here. Just got a question regarding beds, and I know this was discussed last night at the Sydney Morning Herald Forum, and the Minister said that he didn't think there was any resources to go above the 85% occupancy, but I think you said differently. And I guess given that most of the teaching hospitals in this state are currently full to capacity, and there will be a need for increased bed capacity until your other reforms such as prevention and treatment of chronic illness come in, but to be realistic, that's going to take a number of years before that kicks in. So I guess my question is to you is, how are you going to convince Treasury to actually put more money towards infrastructure to actually provide the beds? Because at the moment we have a hospital such as mine, which is being built where I work, which is too few beds, and this is the case in the rest of the state. So I guess that we have a Treasury that actually gives $600 million per year for new capital infrastructure. More is needed. How will you convince them?
Yes, thank you. I spend a lot of times with Dr. Joseph at Royal North Shore, which happens to be my local hospital. One of the things I pointed out to Carmel Tebbit last night was she was on the same parliamentary committee which heard evidence from you and many others, including the representative of the AMA, into the Royal North Shore Parliamentary Inquiry, where it was suggested that an 85% bed occupancy rate for adult overnight acute beds was an appropriate level. She's in denial. And whenever asked the question about bed occupancy rates, they include cots, bassinets and everything else. So excuse the actual figure. I think if you really look at overnight adult acute beds in the tertiary level or just under, it is feasible, it is doable, and we will be putting out policies in this sort of area in the next few days.